Welcome to ED Debrief, where data meets the gurney. I'm your host. Today, we're doing a deep dive into something really impactful in healthcare, something we're seeing more and more, doctor shaming in the Philippines. And this isn't just, about a few angry posts online. It has these ripple effects hitting our healthcare workers hard and honestly the whole system we rely on. So to help us navigate this, we're really lucky to have Dr. No Name joining us. He's an emergency medicine physician. He's seen firsthand how this public shaming can affect things and well, he understands the really delicate balance needed in healthcare. Our aim today is to get past that surface level outrage, to really understand the systemic stuff going on underneath it all. So let's start there. This term doctor shaming, it's become quite common, unfortunately. How do you see it? What does it typically look like?
Well, it's essentially public criticism, right?
Yeah.
Usually hitting social media.
Yeah.
Doctors get called out for things people perceive as shortcomings. Could be anything from accusations of sleeping on duty, maybe seeming rude, sometimes even refusing treatment, or, and this is a big one, charging fees that seem too high. And these posts, they can just explode online, spread like wildfire, really fueling public anger very quickly.
Yeah, and we saw a perfect example just recently, didn't we? That viral post. It accused a specialist of delaying a patient's discharge, supposedly over an unpaid professional fee. The family argued the surgery wasn't, quote, major, and the fee just felt way too high. So that story blew up, painting the doctor as, well, lacking compassion. But here's the question for you listening. Is that really the whole picture? Or is social media just giving us that, emotionally charged, maybe incomplete view?
That's exactly it. What's fascinating here, or perhaps concerning, is that while, yes, some complaints might have merit, a lot of them, maybe even most of them, they actually point back to these bigger systemic gaps in our healthcare. It's often not about personal malice from the doctor. Think about it. Doctors in the public sector here, they're dealing with huge patient loads, hundreds sometimes, in a single day. And they're working with really limited resources. It's a tough environment. Social media posts, they almost never show that reality, the behind-the-scenes stuff. They don't show the decade, maybe more, of intense training a doctor goes through, or the sheer exhaustion. You know that picture of a doctor or an intern asleep? It could be someone utterly burned out, catching a rare 5 minutes. It happens. And these posts often miss that a decision, maybe one that seems harsh, is frequently based on strict clinical safety rules or hospital policy. It's not just a personal whim. Oh, and that intern on their phone. People jump to conclusions, assume they're slacking off. But often, especially in the ER, they might be double-checking a critical drug dosage, looking up urgent lab results, or trying to coordinate care. It's part of the job now, using digital tools. The really tough part is when the whole narrative gets boiled down to this heartless doctor versus helpless patient thing. It creates this deep culture of mistrust. And that can lead to what we call fear-based decision-making among doctors and nurses. Just imagine an ER doctor hesitating before a critical, risky procedure, not because they don't know how, but because they're terrified. Terrified of the public backlash if anything goes wrong, even if it wasn't their fault. That hesitation. In an emergency, it can cost a life. There was a study, I think in 2022 in NCR, that really showed this gap. A lot of people said they didn't agree with doctor shaming in principle, but they still felt more could have been done for the patient in specific viral cases, often without really getting the full context or the constraints involved.
Wow, that puts immense pressure on them, doesn't it? And a huge part of that frustration, the feeling of helplessness from the patient side, it often seems to circle back to money. Let's tackle that head on. Professional fees, why do doctors charge them? And why do they sometimes seem so excessive to the public?
Yeah, that's crucial. It's really vital to understand that physicians are professionals, like lawyers, like engineers. They're highly trained specialists. They invest often more than 10 years of their lives in incredibly demanding education and training. And it doesn't stop there. They have ongoing costs, licensing fees, mandatory continuing education to keep their skills sharp, and importantly, malpractice insurance, which isn't cheap. So charging a professional fee, it isn't about greed or refusing to help. It's fundamentally about sustaining their practice. It's about being able to continue providing those essential, sometimes life-saving services. It's how they make a living, yes, but also how they maintain the very ability to help patients. Now, if a patient genuinely cannot afford the fee, and that absolutely happens, the ethical responsibility for bridging that gap ideally should fall on the government safety net. That means effective programs like PhilHealth or government subsidies or the public hospital system itself taking up the slack. It shouldn't automatically become the sole burden of the individual doctor to work entirely for free. I mean, charging professional fees is standard practice globally. It's how healthcare services are sustained everywhere,
Okay, and this is where our deep dive gets really interesting, pulling back that lens to see the wider financial landscape. Because when you look at the actual numbers, the reality is pretty stark. PhilHealth, our national health insurance, on average, it covers only about 30% of a hospital bill. Sometimes it might reach, say, 52%, maybe a bit more in specific cases. But even then, that leaves patients facing potentially massive out of pocket costs. OOP costs, as they're called. And the stats really hammer this home. Back in 2021, the average Filipino was spending nearly 10,000 pesos a year on health expenses and household out-of-pocket payments. They were the second biggest source of health spending overall. That's huge. So when faced with this huge gap, what do people do? Often they resort to what some call the 4Ps. There's pagtitis, just enduring the symptoms, delaying care, hoping it goes away. Then pangungatang, borrowing money, often from informal sources, getting into debt. Then pagmamakawa, soliciting help, asking for charity from relatives, friends, politicians. And finally, PhilHealth, which ironically often only gets fully accessed when someone is already admitted to the hospital, maybe when things are critical. And you mentioned PhilHealth's safety net, but even its no balance billing policy, that's mainly for sponsored members in government wards,
Mhm.
right? It's not universal. So many people still end up with significant OOP expenses, sometimes even having to buy their own medicines because the hospital pharmacy is out of stock. Which really highlights this crucial systemic problem, the anger, the frustration from these huge financial burdens. It often gets directed right at the doctor, the most visible person in the interaction, even when the root cause is really the system's failure to provide adequate universal coverage.
Exactly. And if we connect that to the even bigger picture, we absolutely have to talk about physician salaries
Yeah.
and the impact this has. Look, a government employed general physician here in the Philippines, they might earn, roughly 40,000 to 70,000 pesos per month, somewhere in that range. Specialists in private practice, yes, they can earn more, but that income is often quite irregular. It depends heavily on how many patients they see. Now, let's just, compare that for a moment. Doctors in developed countries, think US, Australia, Singapore, places many Filipinos migrate to. These are OECD countries, the major developed economies. Even doctors just starting their careers there can earn the equivalent of, maybe 500,000 to over 1 million pesos per month. Yes, okay, the cost of living is higher there, absolutely. But usually, the social safety nets are stronger too, and there's generally better system support for healthcare professionals. So this huge pay gap, it's a massive driver of brain drain. It's one of the main reasons our medical talent leaves. The Philippines is literally the world's leading exporter of nurses to these OECD countries, and we rank 6th for doctors migrating there.
Low salaries are a big push factor, obviously, but it's also about poor working conditions sometimes, outdated technology in some places, and just a general lack of good employment opportunities, especially outside the major cities. And here's the really painful irony. Often, the same society that criticizes doctors here for charging fees or for perceived failings within a stressed system will then celebrate those same doctors when they succeed overseas. But that success abroad means they're lost to us. This brain drain just deprives our own country of desperately needed medical expertise, putting even more strain on the system left behind.
Right. So when you put all these pieces together, the low pay, the system gaps, the public pressure, the consequences of doctor shaming become really clear, and they're severe. It's not just about hurting one doctor's feelings. It damages morale across the board. It leads to burnout. We're seeing so much burnout. And this fear, this constant fear of public backlash, it can actually make doctors hesitant. Maybe they avoid taking on high-risk cases, not because they don't care, but because they're afraid of the consequences if the outcome isn't perfect, even if they did everything right. And that directly impacts patient care quality, doesn't it? Hesitation in an emergency setting where every second counts. That can literally cost lives. So instead of building a culture where we can learn from mistakes, a safety culture, we end up with blame and silence. It also makes the distribution of doctors worse. Why would a doctor choose to work in a poorly resourced rural area facing immense pressure and potential shaming if they could work in a private hospital in the city? This leaves many communities tragically underserved, and overall, it just erodes trust in the whole system. Hospitals, doctors, everyone. The Philippine College of Emergency Medicine, PCEM, they're the main body for ER docs. They've actually warned about this. They said public shaming and cyberbullying directly compromise emergency care. And they also pointed out that filming or recording in the ER without consent, it's not just a privacy violation under the Data Privacy Act. It actually interferes with providing critical care. It disrupts the team. It's dangerous.
So, look, the answer isn't to shut down complaints altogether. People have a right to voice concerns, but it needs to be done through the proper channels. There are avenues: hospital grievance desks, professional licensing boards like the PRC, maybe the Department of Health. Those are the places for formal complaints, not a Facebook timeline.
Absolutely. And this really brings up an important point, a question for ever listening, for the public. Before hitting share or post on that angry story, maybe just pause. Ask yourself, do I really have the full picture here? Have I actually tried talking to the doctor involved or the hospital's patient assistance office first to understand or resolve the issue directly? We really need collectively to try and shift away from this culture of blame and move towards a culture of solutions. That means fostering an environment where we can talk about challenges, even mistakes, openly. An environment focused on learning and safety, not silence driven by fear.
At the end of the day, you're right. The health of our healthcare system, it's a shared responsibility. It involves all of us. Our doctors, our nurses, they're there to heal. They dedicate years, decades to learning how to do that. But they can only do their jobs effectively if they feel supported, respected, and yes, fairly compensated within a system that actually functions properly. Doctor, thank you so much. This has been incredibly insightful, helping us unpack such a complex and sensitive issue today. So, for everyone listening, what does this all mean for you, for our shared future in healthcare? Well, it means maybe we need to move beyond just blaming individuals when things go wrong and instead collectively advocate for those bigger systemic changes. Things like stronger, more reliable health coverage, more transparent hospital billing, timely payments to hospitals and doctors so they can actually function. Changes that truly support our healthcare heroes and ensure quality care is accessible for everyone. That's it for today's ED Debrief, where data meets the gurney. Let's keep this conversation going, but maybe with less anger and more focus on finding solutions for a healthcare system that truly works for all of us.